I think to some of the things you just mentioned, it's, do not miss the sunrise. It's critically important to setting your circadian rhythms and your hormone cascade. Limit artificial light at night, either by just don't have it on or wear the glasses to be filtering the light reaching your
Hi, and
eyes.
welcome to the podcast. And today we have Dr. Michael Twyman, and I'm so excited to have you here. Dr. Twyman, I came across your work in the quantum biology space, and I think your story is so unique. And would you mind just giving the viewers a quick background of who you are, how you came into this space? Yeah, let's just start with your story and go from there.
Sure. So I'm Dr. Twyman. I'm a board certified cardiologist. I help people not have heart attacks and strokes. I went through the traditional, Western training, finished that up ultimately in 2012. I had a kind of slight detour for the Navy. I was doing internal medicine for them for a while. And then I was very rewarded by helping people who were very sick with cardiovascular disease in the hospital and the ICU and such. But I always had an idea of like, well, maybe if I had these people 10 years before this, I wouldn't be seeing them in the middle of the night with a heart attack, stroke, or heart failure exacerbation. I initially went down the kind of the rabbit hole of functional medicine, where you learn more about how to use advanced labs and some imaging to figure out what's going on. And it was very useful, but ultimately kind of stumbled upon the biohackers back in 2017. Plus the biohacker glasses. I was taking a long trip over to Asia, and I knew that jet lag would be pretty severe, jumping 14 time zones in a day. So saw an article that talked about these blue blockers. I didn't understand the science, but bought the glasses anywhere. Wore them on the plane, and they're the actual kind of the red ones where you look like the Unabomber when you have them on. And got over to Asia, and the jet lag was present, but maybe about one third as bad as I experienced in the past. I thought, well, that's super interesting. I don't know how it works, but I'll figure it out when I get back. So enjoyed my trip. When I got back, then stumbled upon the work of Dr. Cruz, and then you fall down the rabbit hole even further and really understand how much it's the light water magnetism that he teaches, how that really kind of is foundational to optimizing your health. And then you realize a lot of this is about mitochondria, and thus, behind me, I got a big mitochondria on my wall in my office, and talk about with patients that, you might be seeing me for your cholesterol or blood pressure or your plaque, but we're going to have to talk about mitochondria at some point.
That's such an awesome story. I love that. So, how did you get into the cardiology specialty?
It was something that was interesting to me when I was in medical school. You do rotations, they're between 4 and 12 weeks long. And the heart is an amazing organ. And the thing that I liked about the actual practice of it was that no day was the same. Where you would round with the attendings, and sometimes you're seeing patients on the telemetry floors, sometimes in the ICU. You'd go to the cath lab and watch them do procedures, go to the imaging labs and watch them do stress tests and ultrasounds of the heart. And then you had outpatient. So you're doing, the kind of preventative work. And, I always thought it was awesome because no day was ever the same, but it was always kind of exciting. Ultimately, I mean, I really did enjoy being, a cath lab jockey, but I really got interested in this proactive preventive cardiology a few years ago. And now that's what my practice is really focused on.
That's amazing. Okay, I read this. Tell me if this is true. Is the heart the only organ that doesn't regenerate in the body?
I mean, it depends on what you mean by fully regenerate, because if you read some of the work of Robert Becker, if you're in the right electrical fields and have the right kind of red blood cell differentiations, you might be able to regenerate some things. But it is best to think about that. If you couldn't regenerate it, what could you do to support the mitochondria colonies that are in your heart? The mitochondria definitely can be repaired. Maybe you can't replace the myocytes in full, but I've seen various facts, but 40% of the volume of your heart is mitochondria. And so focusing on
Wow.
optimizing how they can regenerate is probably the key.
Okay, so can you define what mitocytes are?
Myocytes, it's a just heart cell.
Okay, sorry. I just wanted to
It's
define
okay.
that. Okay. Can you help us explain mitochondria and what could you do to help regenerate that?
So the mitochondria are the organelles in your cells that help you transform energy from your environment. I often talk about them being engines, and they're engines that you need to optimize if you want to have peak brain power, peak cardiovascular functioning. The ovaries have the most energetic demands to grow a new human, but after the ovaries, it's the heart and brain. That's why most chronic diseases are in one of those two organs. You only inherit your mitochondria from your mother. That was information discovered by Dr. Doug Wallace at the Children's Hospital of Philadelphia many years ago. So often when I work with patients and I'm taking family history, I always want to know first, how healthy was your mom? How healthy was your grandma on that side? Because that's your potential in life. If they were healthy women, you were, given good batteries, good engines. If your mom and your grandma were pretty sick with autoimmune conditions, cancer, heart disease, you're born, but it might be like you have 20 to 30-year-old engines. And so then by the time you're 30 years old, you're actually like 60 years old on the inside. The mitochondria are always taking cues to their environment, and light is the biggest zeitgeber or time giver. Before they invented light bulbs, the bright light in your eye was sunlight. At nighttime it was dim. Maybe you had fire, and you went to bed when it was dark. Mitochondria are wanting to sense that day-night cycle because when it's nighttime, they can repair. And there's processes called apoptosis and autophagy. Think of it as rebuilding the engines or replacing the engines. So you're going to stress your engines throughout the day based off of what you're eating, how you're moving, how you're being stressed in the environment that you're in. But at nighttime, you have to kind of repair from that damage. And that's what happens when you're sleeping. So the mitochondria, they need to be able to sense the light to be able to know what to do.
So it's interesting because if you look at your family history, like for me, when my mom was diagnosed with cancer and she was age 30 at her diagnosis, like, and I just thought, there's nothing I can do. Like, that is going to be my life. And I always joke about, like, I think I manifested cancer at the age of 35 because I just always said, like, this is what happens in my family, right? But it wasn't until after that diagnosis that I was like, oh no, like, it's my environment. I can, and that's when I came across the work of Dr. Jack Cruz too, and light and all these other things, especially my diagnosis was melanoma. So it was very fear driven from the sun. And I was like, this doesn't make sense. Like, the sun gives life to everything on earth. And so, my kind of process on how I processed like family history and then learning about mitochondria and then learning about the sun and how healing it is, it kind of was like a different pathway than what you took. But like at the end of the day, it's like now that I know this information, I'm like, I feel like I have to shout it from the rooftops. Like I have to share this information because I mean, there's so many, your body is meant to heal. Like you just talked about two of the processes that we have that literally fixes things like while we're sleeping, right? And so there's so many things that we can do to affect our health. Our body is a healing machine.
That's why I often tell patients is that, if you get out of the way, the body has an amazing ability to regenerate. At times, are the tools of Western medicine going to be utilized? Yes, you sometimes need to throw the kitchen sink at people to put all the fires out. But if you can get the body out of the environment that broke it, oftentimes good things happen.
Yes. Well, so I have a question for you around cholesterol because there's like all this debate going on about high cholesterol. Is it bad for you? Should you be on a statin? Right. And so I know how I feel about that, but I wanted to get like your perspective on it.
Sure, this is a daily question I get asked at my practice. So cholesterol is not bad for you. Without cholesterol, you're not going to be alive. You use your cholesterol to make your hormones, your bile acids to digest your fats, your cell membranes. But because cholesterol is waxy, it will not float in the liquid blood. So cholesterol is wrapped up with something called a lipoprotein. It's a lipid protein carrier. And so I talk about with patients that, think of them as like cargo ships. They're kind of the shape of a sphere, and I often use the tennis ball as that example. So the cholesterol goes inside the lipoprotein and then floats through the blood and is delivered to the organs that need what's inside the lipoprotein, which is mostly triglycerides, which are energy, but there's fat soluble vitamins, there's phospholipids, which are building blocks for cells, and there's a little bit of cholesterol. The cells aren't necessarily waiting for the cholesterol, they can make their own supply. But if your lining of your arteries, which is called the glycocalyx, is healthy, the cholesterol particles slide on by. But if that glycocalyx gets damaged for any reason, high blood pressure, high sugars, infections, heavy metals, plastics, then the lipoproteins are more attracted to the endothelium, may get retained in the underlying intima, cause inflammation in the arteries, and then plaque will build up, and cholesterol is just part of that process. Yes, there's going to be clotting factors, there's going to be white blood cells. But the cholesterol is not the initiating factor. It's something damaging the glycocalyx, then the lipoprotein getting retained and dropping off its cholesterol passenger in the wrong place. So cholesterol will always be present in plaques, but it's not always the number one thing driving the plaques. Something damaged the lining of the arteries first. So you have 60,000 miles of blood vessels. They're coated with this glycocalyx, which is this microscopically thin gel coat. If you think of taking a fish out of water and it's slimy, that's what the arteries are lined with. And in the quantum world, that slime is essentially structured water or coherent domains. That negatively charged gel repels the negatively charged lipoproteins from sticking to the artery in the first place. So all the things that you teach people about grounding and saunas and photobiomodulation, that's trying to support the water that's in that glycocalyx from having the lipoprotein stick there in the first place.
So, what could we do besides, expanding our easy water? What else could we do to make sure that that lining doesn't get sticky?
So this is a case where it is best to test, don't guess. You have to look and see what's going on with the arteries. What's in your blood, it's interesting, but you really want to know what is going on biophysically. At home, you can monitor your blood pressure. Your blood pressure should be less than 120/80. And then in the office, there's tests to take a look at the elasticity of the arteries. It's a test called the pulse wave velocity. So are your arteries stiff or are they elastic? They should be elastic. We'll let you be able to expand the arteries and snap them back. In our office, we have a device called the endopath that tests how much nitric oxide can be released from the artery lining. Nitric oxide's critically important to vasodilate or open up the arteries, but nitric oxide also repels the cholesterol from sticking to the lining of the arteries. And you get nitric oxide when you exercise and blood flows across your arteries. You get nitric oxide when you eat green leafy vegetables and the nitrates break down in your saliva to nitrites. There's a conversion that happens in the stomach that nitric oxide gets released. And then UVA. So when you're outside and UVA wavelengths of light hit your skin, nitric oxide is liberated. You also get it with nasal breathing, but I don't think that is as big of a mover as exercise, the diet, and sunlight.
So, what is your opinion on like taking a statin?
I always start with patients that it's a tool and use the right tool for the job. If you've already had, a heart attack, stroke, stents, bypass surgery, and you don't want to have that happen again, statin should be a consideration for those individuals because it has been shown that they have less recidivism or recurrent events. The challenge that comes in people who are primary prevention, they've never had an event. Is the statin going to help that person? Quote, unquote. The benefit is probably smaller in those individuals. It's not zero. So you have to look at all the other risk factors to decide, is it even something that should be considered? So I always tell people, statins are tools. They shouldn't be used in the water where everybody takes them. And it's definitely a case where some people will benefit from them. But not everybody can tolerate the medicines, or they just choose for whatever reason, they don't want to take them. There's 3 other classes of medications that have outcome data for MACE, major adverse cardiovascular endpoints, meaning less heart attacks, strokes, procedures on your heart, or dying. The stuff patients actually care about. Nobody cares about the cholesterol in their blood. They just care if they go to the hospital and they're having a heart attack and need a surgery to fix the heart attack.
Right. So, you said at the very beginning that you love to see patients like 10 years before they're at risk of cardiovascular event. How do you treat these patients? Like, so you run all the tests in your practice, and then are there certain things that you recommend as preventative measures, or how do you go about that?
Sure. And, there's kind of 2 ways, people come to me. They've either already had an event and they're like, hey, I don't want this to ever happen again. Or they have people that are like, hey, my dad had a heart attack at 52. I'm 40 years old. What do I need to do so I don't end up like my dad? And then we start the process. So we do the testing that looks at nitric oxide. We look at arterial elasticity. We look at genetic markers, particularly LPLA. 20% of the population has high LPA, and it can double your risk of developing plaque in your arteries. We do scans of the carotid artery that look at the thickness of the intima, which gives us an idea if there's inflammation in the arteries. We can also assess if there's carotid plaque. If you have carotid plaque, it's about a ballpark 80% correlation that you'll have something going on in your coronary arteries as well. depending on the age, but if you're 35 or above, we'll generally recommend a CT coronary calcium score, which is a CT scan that looks for hard calcified plaques in the arteries. Your calcium score should be 0 forever. But if you live long enough, often you develop plaque in your arteries. And the more calcium you have in your arteries, the more plaque you have. So we'll kind of risk stratify people with those testing. And then we do a very comprehensive kind of lifestyle evaluation because ballpark 80% of what's going to happen is how you live your life. Manage your stress. How do you sleep? How do you move through space with exercise? What are you fueling the body with? And as you know, like in the cold, there's no perfect diet. It depends on what kind of mitochondrial engines you have and where do you actually live in the world. And then you figure it out. Okay, are they getting enough DHA from seafood to be able to run their retinas and their brains? Do they have enough protein to maintain the muscle mass that they want to have? And then are they eating in a circadian rhythm friendly manner? And I just tell people like, ideally, if the sun's out, that's your feeding window. If it's dark out, stop eating. And then go from there.
Do you recommend any kind of fasting protocols?
It would sort of depend on what the person's goals are. And the way I would classify is that, I want pretty much everybody to do time restricted eating, eat during daylight hours. But if you're fasting, and my definition would be that'd be 24 hours with no foodstuffs. You can have water, but no foodstuffs coming into the system. Now, if somebody has, a autoimmune condition, a cancer, something serious, they're very metabolically unwell, I think it may be reasonable for some people to consider a fasting protocol. But if you're generally healthy, I don't find it to be all that useful. And then there's also some downside is that if you start doing more prolonged fasting and basically your mitochondrial engines in your skeletal muscle are going to be stressed during that time, if you start eventually kind of breaking down your skeletal muscle because no nutrients are coming in, that's sort of like you're taking away parts of your engines. And then when you start adding fuel back in, you don't have as much engines to burn the fuel. So you want to mind your mitochondria everywhere, but you can't break them down in the skeletal muscle and expect to live well for a long time. So it doesn't mean you got to be super muscular, but you do not want to get sarcopenic where you're having muscle wasting.
What I've been really interested in lately is looking at MRIs scans and particularly visceral fat. So I've been studying this pretty hardcore the last few months. One of the biggest things that really surprised me is finding visceral fat around the heart. Is that
Yeah,
something you see in your practice?
at times. I mean, I don't do a lot of cardiac MRIs at this point because I don't have that many patients who would warrant it. They don't have myocarditis or severe heart failure. But if people are doing like and I've had one done, if you've done like a head to toe, MRI for like cancer screening, you can then kind of look at those images. But yes, I mean, if you have excessive visceral fat on the outside of your heart, there's all sorts of interleukins and cytokines that are being released by those adipocytes, those fat cells, and they're being directly dumped into the coronary arteries and on top of the myocardium. And it's very inflammatory to the cardiovascular system when that happens. So if you have visceral fat, then you got to figure out your light environment first. You got to get your sleep dialed in, and you got to get out of the environment that's laying down all this visceral fat.
Yeah, isn't that fascinating? I mean, you think about visceral fat being around the organs, but I never thought your heart is an organ. Of course, there might be visceral fat around the heart. And now knowing what you had just taught us about the lining and how the plaque builds up and all those things, I'm like, of course, that would make so much sense because it's dumping it all right there. I mean, the heart is just such a fascinating thing to me. Let's talk about like, how some people say like the heart is a pump and then other people are like, like, what is your opinion on that?
That's a good one. I got asked that on um, a webinar I did last week, and I said, I'm definitely not an expert on it. I've read the book, the human heart, and it's an interesting theory. I'm not against the theory, but it wouldn't necessarily change my practice if it was true. There was somebody who basically is an artist and came up with the idea of something called the chestahedron, which is a seven-sided polygon that sort of looks like what the left ventricle looks like. And the left ventricle is the part of the heart that receives the blood from the lungs and then pumps the blood through the aortic valve into the aorta, and the blood goes up to your brain, down your coronary arteries, down to your legs and such. But you have nearly 60,000 miles of blood vessels. So you can postulate that, there's no way that the heart, which is about the size of your fist, is going to be able to generate enough force to hydraulically push the blood through 60,000 miles of blood vessels. So, what the theory is that the heart is potentially the way it's ringing is acting more like a vortexer or a hydraulic ram, that when the blood comes into it, it's pushing it along. And then with the coherent domains in the glycocalyx, the blood then slides across the lining of the arteries, kind of like a maglev train would do it. So it's sort of like getting the ball rolling. And then if you have a healthy glycocalyx, the blood continues to pump
Oh,
or flow.
fascinating. Yeah, it's like once the boulder is going, it's going, right? And if there's something that slows it down, so that's a great analogy. I've been to your office before, and you have this huge photobiomodulation or red light therapy device in your offices. So I'd love to talk about, why do you use that in your practice? Why do you recommend it for your patients, and how does that make your heart healthy?
Sure. So we have the 8 foot tall, 4 foot wide Firehawk from EMR Tech, the same one that Jack had down in his Louisiana farm practice. And we consider it the beast, because that thing is a beast. It was 350 pounds, and then we had to put it together and lift it up. It's a full body, a photo biomodulation panel, has the right wavelengths of red and infrared light. And the reason we have it is that I'm always looking for technologies that could augment people's health span and longevity. And I always use it through the lens of, is this something that's likely to benefit the mitochondria? And photobiomodulation is one of those things. So shortly after discovering how circadian biology works, at some point you come across red light therapy, and you start reading the science behind it. And then when you realize that its target of action is mitochondria, and that the heart has a lot of mitochondria, it starts clicking. It's like, maybe this has a benefit for the heart. So we ended up getting it partly to be able to demo patients, this is what, PBM photobiomodulation is, and this is what you should experience after a session of it. Now, are there great trials in the heart world? That short answer is no. If there are, most of them are probably still in Russian and not been translated, because the majority of the cardiovascular literature for PBM has been done in Russia. But there was a super fascinating PBM trial done a few years ago in Israel. It was only done on 24 patients, so not a huge study, but it was done in patients who were having heart attacks. The patients were all immediately taken to the cath lab. So they're going to all get treated with balloon angioplasty and stents. So half the group got standard of care treatment, the other half got the same treatment. But during the cath, they got PBM provided over their tibias, not over their heart. And it was a session that was less than 2 minutes long. And I think it was around 810 nanometers. It might have been 808 or 812. I can't remember the exact, but it was in the infrared spectrum. They did it during the cath, 24 hours later, 3 days later. And the patients that got the PBM, they had smaller heart attacks by blood work. The biomarkers were less increased. The thought would be that, with the light going into the system, the stem cells in the bone marrow were activated and were honed in on the areas of oxidative stress and inflammation that was going on at the area of the myocardial infarction. Now, did the patients do better long term? No, they both did the same, but it's a proof of concept that definitely wasn't dangerous to apply light therapy during a cath, and it may be potentially benefit, but they would have to do bigger studies before people would say, oh, this is the standard of care. But if it can help you during the kind of the worst of the worst, you're having a heart attack, what could it do to help support the heart during normal times? And so I try to kind of come up with ideas like, well, what could stimulate your stem cells without necessarily having to inject stem cells, and it's using these type of panels. I always want people to do sunlight first, but if you're already kind of topped up on the sun, or you just literally don't have access to it, this is where these panels could become beneficial.
Would you be able to explain the difference between like infrared light and then infrared heat?
The synonym, it's basically the same, but certain wavelengths, will be more present as heat versus ones that'll be infrared, and you don't feel or see. You don't see them, either of them, but some of them you would not necessarily feel. The infrared, it goes from 800 nanometers to above 3,000 nanometers. I used to use an analogy, and if people are under 40. Sometimes they don't always get it, but it's the difference between AM radio and FM radio. They're just different radio stations that your body's tuning into.
Yeah, I love the idea of us being light beings. There's just something about, from a spiritual sense, and then also from just a biological sense, we are truly light beings. We have light receptors all over our body, right? I just love that analogy talking about heat and light because that's what our body is made out of, right?
I mean, that's sort of what the mitochondria engines do. They're generating heat so that you don't freeze to death when the ground's frozen.
Yes, I love that. Um, do you think that there is any correlation between like autoimmune disorders and heart disease?
There absolutely is. As I was taught by one of my mentors, Dr. Mark Houston, that there's infinite insults to the vascular system, but only three finite responses. And it's oxidative stress, inflammation, and autoimmune dysregulation. So the body will try to repair from the insult by utilizing one of those three processes. And if the body goes down the pathway where then you have a chronic autoimmune condition, then it's much more likely that the vascular system will be impacted by it. Now, it's not the case where automatically if you have lupus or rheumatoid arthritis, you're going to get coronary artery disease, but you have a higher preponderance that you would. So I always ask patients about their own personal history of autoimmune conditions, family histories, and then in the blood work, well, it's not perfect, but if your HSCRP is elevated and you don't have a ready explanation like, oh, I had flu last week, or I've injured my knee and I'm on the mend for it. If you have a CRP that's above 10 for an extended period of time, you have to start wondering, does this person have an autoimmune condition?
You said, sorry, I got inflammation and autoimmune. What was the first one you said?
Oxidative stress. It's
Oxidative stress.
oxidation.
Okay.
So
Yeah.
rusting from the inside out is how I explain it to patients.
Oh no. Oh, now I can't unhear that.
Yeah, right.
Oh no. Could you just explain what oxidative stress is, though, in just simple terms?
So we're both breathing oxygen right now, and we're using that oxygen to basically metabolize the foodstuffs that we ate for lunch. Your mitochondria engines, they're going to, in the presence of oxygen, burn the carbs and the fats. It's a little bit more complex than that, but as you're breaking those things down into electrons and protons, you have to use oxygen during this process. And if your mitochondria are efficient, you don't leak a lot of electrons out of the system. But if the engines are not very well maintained, you have kind of bad spark plugs, a lot of electrons leak out of the system and they react with the oxygen. And then you develop reactive oxygen species, aka free radicals. Those free radicals can damage the nearby proteins and cell membranes in the mitochondria and other cells. So think of it again as like a rusting process. The oxygen is just interacting with other things and turning it to be oxidized.
And that's what those processes during your sleep are supposed to be scavenging for the free radicals to clean up, right?
Yeah, your mitochondria makes free radical defenses. Your glycocalyx makes something called superoxide dismutase, or SOD. So if you have a healthy lining of your artery, your body can manage the normal free radicals that are being produced. It's just this excessive generation that kind of overwhelms the systems. And then the more oxidative stress you have, it's a feed forward loop where then you'll have more and more inflammation. Your immune system's getting more and more activated. And as that process kicks up, different interleukins and cytokines start damaging the lining of the arteries.
Okay. I always explain to my kids, if you trip and twist your ankle, inflammation is good, right? That's an acute inflammation, but we're talking about here chronic inflammation, right? Cool. Well, let's see. What else should we talk about?
Sleep. I mean, sleep is the thing that I think most people don't really optimize until they kind of realize that they're really sick, or they go down the rabbit hole like, this is one of the biggest levers you can pull to have optimal brain function, optimal exercise performance. It's the recovery aspect of it. And while sleep isn't as exciting as talking about nutrition or exercise for many people, it's literally more important. The mentality, sleep when you're dead. Well, you're not going to live long enough to have that kind of thing if you really do it for too long. And unfortunately, like in medicine, we go through the gauntlet of training. I did 10 years of training after college to do what I'm doing now, and much of that was in a sleep deprived state. There's often nights, we're up 36 hours or more taking care of patients in the hospital, and you definitely feel sluggish. I mean, the data is that, if you're that sleep deprived, it's basically equivalent or worse than being intoxicated. And you're making life and death decisions at that point. Fortunately, I don't think I, did anything majorly abnormal to patients when I was, in that sleep deprived state. But it's not something I would definitely repeat at this point, knowing what I know about sleep. I mean, it was horrendous to subject myself to that. But that was in my 20s when I had better ability to kind of bounce back from that. But the sleep, the sleep hygiene is probably the lowest hanging fruit for most people. On my questionnaire, I always ask, like, are you seeing the sunrise? Are you blocking blue light? Well, many people never even thought about that. But then you really ask them, like, well, when do you actually try to go to bed? When do you wake up? And maybe people are socially jet lagging themselves. They get up early during the week, and then Saturday they stay out. Sunday, they sleep into noon, and then Monday morning they try to get back on check. And it's kind of like basically being daylight savings time every Monday. Your body's just not knowing what time zone it's in, and that's very uh, you know, inflammatory, long term to the system. So I just generally kind of walk people through like, what's an optimal day? It's like, pretend it's 200 years ago. The first light you saw was the sun. You go outside, get some light in your eyes, go about your day, go get your meals, go find more food. And then the sun sets, it's time to start winding down. I have all the biohacker toys, all the red lights, the chroma lights, the PBM panels, but natural light is the key. Like I have a lot of skylights and windows in my places. And when it's dark, it's dark. And by 9 o'clock, I can't usually stay awake. So go to bed, sleep. I can't sleep 8 hours. I sleep like 7.5, 7:15, and I'm wide awake by 5 a.m. every single day. After a while, you get into that system and you really realize like how much better you can perform. Like my brain, my exercise capacity is always way better when I'm consistent with my sleep. And so I don't want to break those kind of rhythms. I kind of call it like Groundhog's Day. Just like if it's working for you, keep doing it over and over again.
That's amazing. And it's funny because I put my kids to bed at 8. And after I started wearing like the red blockers, all of a sudden I'm in bed by 8:30. And as someone who literally used to stay up till midnight for no reason except for scrolling or watching TV, I'm like, my sleep is so much more important now. And then for some reason, that 5, 6 o'clock hour in the morning before the kids are up, before the sun is up, it's such a precious time for me where I get up and I only turn on a red light bulb in my family room, but I journal and I pray and I meditate. It's my special time that I'm like, this time is amazing. It's so much better than having that 11 to 12-hour time where you're exhausted, you've been up all day, you're just watching senseless TV or whatnot. And yes, going to bed early has made one of the biggest differences in my life. But I think, again, like we see the sunrise every single morning. We take a UVA walk with the family 3 miles every single day. Like we've incorporated these like really small habits that are making huge differences like in our light environment and in our lives. So what would be like the top 3 things that you would recommend that are free or very low cost that somebody could do for their own heart?
And that's the key is that the greatest majority of things, are free or very low cost. Are there times and places that supplements and medications might be useful? Yes, but the basics are the basics, and that's where you get the greatest, bang for the buck. I think just some of the things you just mentioned, it's, do not miss the sunrise. It's critically important to setting your circadian rhythms and your hormone cascade. Limit artificial light at night, either by just don't have it on or wear the glasses to be filtering the light reaching your eyes. You'll find out if you use them routinely enough, you're probably not as much of a night owl as you thought you would be. Now, you can force yourself to stay up anytime. If you get a lot of bright light, you're going to pump cortisol and you're going to get your second wind and feel like, oh, I could do this. But if you actually block your artificial light at night and you wear the dark red lenses, I don't know too many people that are impervious to their effects. I'm sensitive like you. Within an hour, I'm going to be asleep if I'm wearing those
Yes.
things. Meal timing, I've been one of the people wearing an Oura ring since probably the first one came out. Side note, it's always in airplane mode. I never have anything electronic on my body that's going to be pinging me with Bluetooth or Wi-Fi or 5G. Um, but the sleep trackers, will give you an idea of like, okay, if you delay your meals 3, 4 hours before bed, you're probably going to have better deep sleep. Cool. Keep doing that. And so it's just doing those little hacks for timing is really the key. I love the idea of a UVA walk. I also get up early because, yeah, I like that time to be doing meditation or talking to my wife or just going for that early morning walk right when the sun's rising. Just clears your mind and get your body moving just a little bit. And then you also know that nobody can take that part away from you in the day. Like the second I walk into work, it could be a catastrophe. I could have a patient who's very sick and I got to deal with the hospital all day long. And I'm not going to get back to like, okay, what my regular schedule is going to be like, but they can't take that morning away from me. I think those are kind of the starter points, really. It's like just, it's the bright light in the morning, darkness at night, buy the blue blockers if you need them, and time your meals. Start there.
Amazing. I heard a statistic. I don't know if you've heard this before, but on the days of the time changes is the number one days that people have heart attacks.
Yep. Yep. On the Monday after daylight savings time, when you spring forward and the people get 1 hour less sleep, there's somewhere in the neighborhood like 20% increased risk of myocardial infarctions on those Mondays. So if you just have that, one day a year, okay. But if you're doing it to yourself every week, that is going to be a problem for more and more people. The body would crave consistency if it had access to it. So again, make it like Groundhog's Day. It's not boring to go to bed at the same time and wake up at the same time. Your brain, in my mind, just works better and you get more done in those other hours than if you start messing around, staying up later, trying to burn the candle both ends, as they say.
Yes, absolutely. Do you know much about your lymph system?
A little bit. It doesn't have its own pump, so it requires the musculoskeletal system to push the lymph back into the thoracic duct, and then that dumps into the superior vena cava. So the lymphatic system is very important for the way it carries chylomicrons and fat through the system. Most people have no concept that it's there unless there's a problem with their lymphatic system. Some people have lymphedema. Oftentimes it's surgically induced. Patients who have breast cancer and surgery on that side, the lymph system gets damaged and that arm will be swollen with lymphedema. But there are lymphedema experts out there that can teach people different wrapping techniques, different exercises to kind of clear the lymph from those organs. And then some people need to go to the point where they're having lymphatic drainage, either manually or there's lymphatic pumps that can kind of pump the lymph through the system.
Now, does it pump it to the heart? Because that's what I've heard when you
It
open
pumps
it
it
up.
into the superior vena cava, which then dumps directly into the right atrium. So it's right before the heart.
Okay. Okay. That's why I was wondering if it was related at all to your heart, because you just always hear that you need to open up this part because that's what opens up the flow to dump it.
Yeah, and it's one of those cases where it's probably the things that, talk about, the sun exposure to those areas, the photobiomodulation, the sauna, those are all things that probably are improving the water that's in the lymph. And so that's how, if you're healthy, you never even think about your lymphatic system. But if you're sick and your mitochondrial engines are poorly working, those people probably tend to have more issues with their lymph systems and getting swelling in those extremities.
What I've noticed wearing the Aura Ring, or and also a continuous glucose monitor, is that your heart really gets pumping when you're in the sauna, and also your blood sugar tends to go up at all. So, any thoughts on that? And I know that that's a temporary stressor that kind of makes your overall system healthier in the long run, but just any thoughts on that?
Sure. I mean, one of the benefits of sauna is that it's basically simulating exercise because it's increasing your heart rate. And as your heart rate increases, your muscles need more metabolic fuel. So glycogen is going to be utilized. Cortisol is going to be high. It's going to tell the liver, pump out more glucose. So yeah, you do get these insights of, oh, when I exercise, my blood sugar goes up. But shortly after exercising, the blood sugars come right back down. So no, it would be unusual if it wasn't doing that is the way I would think about it.
Okay. Oh, you know what else I wanted to mention was what I find very cool about your office space is you guys hardwire all your internet. You have mostly no lights on in your office, or if any, I don't really remember, but I don't remember any lights being on. I mean, you guys have floor to ceiling like windows. Talk about what you've done, even though you're in a big building in your environment. I think it's so cool what you've done to control what you can in your space.
Thank you. Yeah, there was some thought put into the office. When I started Apollo Cardiology back in August of 2019, it was an idea, and I had to kind of figure out, okay, how's this all going to work? So we were in a co-working space. It was just a one room. It was myself and my team member Cassidy at that point, And then once we kind of figured out the business model and, the ball was rolling, we knew we needed more space. And I had worked in this particular building before, and I took a tour of some different spaces. And the one that I ended up with was the one that I was like, okay, I have an idea for this. And so it's a corner unit. So it has mostly floor to ceiling windows on two of the three surfaces that we have. The overhead lights, I either have disabled them or they're on maybe 5 times a year. If the room is too dark and the patient says, I can't see, then I'll turn them on. But I'm fine with it being as dim as possible. I do have, some, red light panels on in my office. It was kind of examples of what red light therapy is, but it's also just ambient light, adding some of the red light back in. And then, literally just this week, I got one of the Chroma Sky Portal lights. It's clipped to my desk right now. So it looks like the sun is in my office when it's gray in February in St. Louis. It at least kind of feels like, you're not going to have like seasonal affective disorder instantaneously in my office. So, yeah, we've tried to keep it as much circadian rhythm friendly as possible. As you know, yeah, we hardwired all our computers. There's no Wi-Fi in our space that we have turned on. I can't control what my neighbors do, but yeah, we do what we can do. So I try to have it be a place where, I'm not going to tell patients to do stuff that I'm not willing to do at home or in my office. So, if I'm wrong with something, I'll change. I'll say, okay, I used to do it this way. We're going to do it this way going forward. So I almost think of our office as kind of like a learning lab that's like, this is what you should try to aspire to. I didn't come up with this overnight, but these are things you can slowly add to your home environment, your work environment. But okay, I am sleeping better if I do these type of things.
Yeah. And I think when my husband and I came to you, it was the one, and we don't see very many doctors, right? We're very much acute care type. We're working on our mitochondria. We're doing all the things at home that we can and whatnot. But we came to you specifically because we had had some family history of heart events. And honestly, just we couldn't have found a doctor more aligned with all the practices that we are already implementing. And it was just so cool to be in your space. Where you've curated this beautiful environment, and the staff that you have are just amazing people. And you just, when you leave your office, you're like, I've made friends. That's how you feel. And so it's just a really beautiful experience that you guys curate there. I highly, highly recommend it to anybody looking for a cardiologist. And we even came all the way up to your state and see you in person. And yeah, it was just a wonderful experience. So thank you.
Well, thank you for the feedback, and that is our goal is to make people literally feel like family. I mean, it's something where we really love what we do. Um, we particularly like working with people who are already this far down the rabbit hole of quantum biology. They understand light water magnetism. They're already trying to implement those things in their lives, but they just need a little bit more guidance on like what else do they need to do to optimize their vascular health. And we have all the toys in one roof, and people come in, we get them screened up, but we want them to have the experience of it. Like, this is not a traditional doctor's office. You're not going to be waiting for hours. It's not going to be a sterile place where you got to fill out 1,000 pieces of paper and nobody knows your story. Like, we really want to know what makes you tick. Like, what can we do to serve you? And then when we help you, you go out to the world, you launch a podcast. Now you're helping thousands or tens of thousands of people. Like, that's what we really love to be able to do.
Oh, it's so awesome. Would you like to share anything more about your practice or how people can get a hold of you?
So my practice is located in St. Louis, Missouri. The practice name is Apollo Cardiology. The reason it's Apollo, a couple of reasons. One, Apollo was a Greek god who was the god of the sun. Helios is as well, but he was one of the sun gods. And then also he was the father of Asclepius, which is the god of medicine. And so our logo, Apollo Cardiology, it's a heart inside the sun. So that's the reason for the name. A practice which focuses on the early detection of cardiovascular disease. We help people not have heart attacks and strokes. And currently, if patients are interested in working with us directly one-on-one, the first visit is in person in St. Louis. The reason being is that sometimes it's state medical licensing laws that are requiring to do that, but also it's because you want to be able to, I think Jack calls it this, like sample the other person's biophotons. It makes a whole lot of difference when you've met the person in person than if you've only done a Zoom type of call with them. You get to lay hands on that person. You get to do the physical exam and listen to their heart tones. So you get to, actually understand why that person is who that person is. We also have all the kind of the head to toe vascular screening, blood work, genetic stuff all in our space. So you're not running all over trying to get testing at 10 different facilities. We can do it all in one day. And then you go back to your own home. The blood work generally takes about 2 to 3 weeks to come back. And when the blood work comes back, we spend another hour going through all your results. And at the end of that hour, you have a written plan of, okay, these are the things you can do to optimize your lifestyle. If you're on supplements, we'll look through your supplement stack and say, okay, this makes sense to be on, or maybe you should tweak this or stop this. And if pharmaceuticals are on the board because you're high risk, oftentimes we can point you to the ones that are going to be the most effective with the least amount of side effects.
Love it. And I remember leaving your office with like feeling blue. I was like, yeah, I'm going to be Smurf tongue like everybody else now. So
Yeah,
cool.
you have to be pretty advanced for me to have that conversation with somebody. That's not a common one.
Sorry.
But if you know about methylene blue, I'll talk about it with people.
Awesome. Well, thank you so much for being on this podcast today. And I know you have like an Instagram presence. You do like Instagram lives, and is there anywhere else where people can find you?
That's the main thing, is that on social media, I'm on Instagram. My name is just Dr. Twyman, DrTwyman. Every Monday night, 6 p.m. Central Time, I will do an Instagram live for about 30 minutes. Early that Monday morning, I'll put up a little box in my story so people can submit their questions ahead of time if they want, or if they're on live, they just drop them in the comments and I answer as many of them I can in that half hour. I love doing it because they're the questions I get asked every day, by the patients that come to see me live. And it's a way that I can reach more people. Not everybody I understand is going to be able to come to St. Louis and work with me one-on-one, but if I can kind of pique your interest, I'm like, okay, well, can I get my calcium score done where I live? Can I get ApoB checked instead of LDL cholesterol? People just need to be educated on what tests to ask their doctors for and empower their own well-being so that heart disease is not the number one killer going forward. I mean, it's going to be, until people are educated to understand, like, it's your lifestyle decisions, how you move through space, your light environments, your sleep, all those things that are in your power really determine who's likely to get vascular disease or not.
I love that. Thank you. And thank you for being of service, and just a beautiful practice that you have. And thanks so much for your time today. I always end the podcast with one question. I think this is just so appropriate since you're the heart doctor. And that is, what does love mean to you?
It's a great question. And yeah, I probably would lack the ability to describe it in language terms, but I mostly think of it as a feeling. And it's more of an idea that it probably is something where it's the biophotons interacting with the other person that you're in the space with. I can't always describe it, but when you resonate with somebody. And, my wife, I just know that she's the one. Like, I don't have the words to be able to explain it sometimes. So I think love is probably more of a, it's a quote feeling, but it's a biophotonic connection, an entanglement.
Oh, I love that so much. Again, thank you so much.
You're very welcome. Thank you.
Bye. Thank you for tuning in to the Quantum Lens podcast. I hope this episode brought you insight, inspiration, and a deeper connection to your journey. If you've loved what you heard, be sure to subscribe, leave a review, and share it with someone who needs to hear this message. Let's keep this conversation going. And until next time, keep aligning, expanding, and embrace the magic of who you are.